My name is Dr. Shiri and I am the doctor today. So I just checked, are you his son?
Yes.
Okay. So I just checked him. Can I ask you some questions regarding him?
Of course.
Okay, so how old he is?
He is 75 years old.
Okay, does he works?
No, he doesn't work.
Okay, where does he live?
He lives in India, Sadar, Betul Bazar.
Okay, what he's complaining about, pain and all?
Yes, he has leg pain in his right leg.
Okay. Does he complaining about anything like vomiting or fever?
Yes, he has vomiting sometimes.
Okay. How many times he vomit?
He had vomited, I think 2 times.
Okay. Does he feel like normally or having some appetite?
No, he is not feeling hungry.
Okay. Do you know when the pain started?
Yes, pain has started 3 weeks ago.
Okay. Does he went to doctor?
No, he didn't.
Does he take any medicines?
Yes, he took inflammatory.
Okay. Did he had any trauma?
No.
Okay. Did he had pain in the other part of the body or only in the leg?
No, only in right leg.
Okay. In his childhood, does he has any problems?
No.
Okay. Does he has any gastric cancer?
No.
Maybe blood infusion?
No.
Okay. Does he smokes or take alcohol?
No.
Okay. Does anyone of his family had myocardial infarction?
Yes, his parents, but not him.
All right. Does he had diabetes?
Yes.
Okay. He did any operations?
No.
Okay. Does he had stroke?
Yes, it happened 2 years ago.
Okay. Thank you so much for this information. We will do some examination and we will let you know. And if I need, I will again talk to you.
Okay.
General condition of the patient is severe and look older to his age, and the consciousness is affected. The posture of the patient is passive. The head of the patient is in normal shape and size. There are no deformities. The mucous membranes looks dry, and the ears are in normal shape and size. Neck of the patient is in normal shape. There are no enlargement or swellings. The skin turgor is decreased, which suggests dehydration of the patient. The musculature of the patient is well developed and bones are in normal shape and size. The nails have normal configuration. The skin of the patient is pale and yellowish, and the patient has low-grade fever around 38.3. The condition of the patient is severe. According to the Glasgow scale, the patient score is 11. He looks older to his age. The skin of the patient is greyish yellowish in color. The mucous membrane is dry, and the patient has temperature around 38.3 degrees. The patient's chest is symmetrical and the respiratory rate is increased and the rhythm is irregular. The breathing is noisy and dyspnea is present. On percussion in upper parts, the lung resonance is clear, but in lower parts there's dullness. And on auscultation, the vesicular breathing is normal, but in lower parts we can hear pathological wheezing and crackles. The patient has shallow and noisy breathing. The patient also has tachypnea and dyspnea. There is dullness in the lower parts, and also wheezing and crackles are present in the lower parts, which all suggest there is dysfunction of the respiratory system. The apex pit is palpable at fifth intercostal space with very weak amplitude. The pulse of the patient is very low and irregular. On percussion, the left border absolute and relative cardiac dullness is detected, upper border absolute cardiac dullness is detected, and right border absolute and cardiac dullness is detected. On auscultation, the patient heart sounds are very muffled and the patient heartbeat is increased. The blood pressure of the patient is 90/60. The inspection shows that patient has cardiac dysfunction with tachycardia, hypotension and hypovolemia. The abdomen looks normal. There is no pain, no local tension, no tenderness of the abdominal muscles, and there is no hernia or visible peristalsis of the stomach and intestines. And the liver is palpable and increased in size. The spleen is also palpable and looks normal in the size. During auscultation, no peristaltic sound or fatty is heard. The tongue and the mucous membrane of the oral cavity is dry. There are no abdominal sounds present, and the size of the liver is increased, which suggests hepatomegaly. And the distal rectal examination shows blood from the anus, and all these signs shows the dysfunction of the GIT. The inspection of the genitourinary system shows there are no swelling, no protrusion of the lumbar and the suprapubic region, and on palpation all the points are painless, and the urinary output of the patient is decreased. The urine is dark yellow in the color and there is no blood present. The inspection of the nervous system shows there is weakness in the arm and the leg of the left side due to the stroke suffered 2 years ago. The inspection of the right leg shows that the color from knee till foot is black. There is no sensation present. There is tenderness and tissue loss. On palpation, the pulse is absent at femoral, popliteal, posterior tibial and dorsal pedis points.
How is?
After diagnosis, we got that he has a gangrene on his right leg.
Yes.
Okay.
The primary diagnosis suggests that the patient has gangrene on the right leg with lower GIT bleeding, left side hemiparesis, severe sepsis, septic shock, and multi-organ dysfunction syndrome. Lab findings indicates liver dysfunction, kidney dysfunction, hyperglycemia, leukopenia, high ESR, low RBC hemoglobin, thrombocytopenia, glucosuria, lactic acidosis, arterial hypoxia, hyperventilation. We can conclude that the patient has multi-organ dysfunction syndrome. There's dysfunction present in the respiratory system, cardiovascular system, hepatic system, gastrointestinal system, renal system, central nervous system, hematological system. For the treatment, patient must be admitted to the surgery department and the amputation of the right leg is required. To fight the infection, we can administer ceftriaxone third generation cephalosporin 2 gram IV every 12 hours with metronidazole 500 mg intravenously every 8 hours. Since the patient is on NPO diet, the infusion therapy is required, and to correct the anemia and hemostatic system, we need to do transfusion therapy also.